Do you have a dull pounding headache that makes you feel sick? You probably have a migraine. A migraine is a neurological condition that includes severe and recurring headaches along with other symptoms. In today's video, we'll be discussing everything you need to know about it. Is a chemical imbalance responsible? What about monosodium glutamate, MSG? Can coffee be a trigger? We'll be talking about all of these and more. Did you know that a migraine is the third most common illness in the world? Don't just mistake a migraine for a regular headache. There is a huge difference. Hey viewers, I'm Dr. Sophia Fahl and welcome to the Lovers of Good Health channel. Before we begin, kindly subscribe to this lovely channel and leave us a like on the video to support the channel. Thanks for doing that. Now let's begin. A headache causes pressure and aching ranging from mild to severe. It usually occurs on both sides of your head. The most common type is a tension headache, which is triggered due to muscle strain, stress, and anxiety. There are other types of headaches including sinus and cluster. While headaches literally involve pain in your head, migraine includes a bunch of other symptoms in addition to a headache. Let's take a look at the symptoms of migraine. You will have a throbbing sensation and intense pain on one side of your head. There will be a lingering pain behind one eye or ear. You'll be extremely sensitive to sound, light and smell. Trust me, a little sound and light exposure will cause you discomfort. You'll experience nausea and maybe even some vomiting. There can be temporary changes in your vision including spots or flashing lights. You may even lose your vision for a short period. I know this can be extremely frightening. Do you suffer from migraines? What do you do to cope? Sound off in the comments section below. People who experience migraines know how painful they are. Aspirin is rarely effective depending on how often you experience symptoms. Migraines can be episodic or chronic. If you have a migraine attack that lasts less than 24 hours and then weeks or even months pass between another attack, you may be having episodic migraines. On the other hand, if migraine symptoms appear for at least 15 days or more each month, and for at least 3 consecutive months, you may be suffering from chronic migraines. The sad part is there is no single test for migraines. Your doctor will ask you about the symptoms and frequency of your attacks. In a study, it was found that people with chronic migraines experience a headache lasting an average of 65 hours without treatment, and for about 24 hours with treatment. People with episodic migraines have headaches for an average of 39 hours without treatment, and about 13 hours with treatment. So what are the causes? Well, that's still a mystery. Some possibilities have been identified, but scientists still need to figure them out. Here are some theories for what causes migraines. Number 1. Chemical imbalances. If there's an abnormality in the required brain chemicals and nerve pathways are not clear, you may get a migraine. Number 2. Central nervous system disorder. There's a possibility that you may have an underlying neurological condition that can trigger a chronic migraine. Number 3. Irregularities in the brain's vascular system. If there's difficulty in your blood flow, or the size of your blood vessels has altered, you can experience a migraine attack. Number 4. Skipping meals. If you experience migraines, skipping meals is a big no-no. Fasting or skipping meals usually triggers migraines, but hang on, there's more. Suppose you normally eat your lunch around 2 p.m, if one day it's 4 p.m, and you still haven't had lunch, your chances of getting a migraine will increase. Try having meals at your routine time. Also remember to keep yourself hydrated, as dehydration also triggers migraine. Number 5. Stress and anxiety. You may have noticed your head going crazy the day before an exam. This is because during these times your stress and anxiety skyrocket, and as a result, you get a migraine. Not only this, but physical stress also has this effect. A really hard workout can put a lot of pressure on your head. Number 6. Bad posture. Many of you may not be sitting correctly while working or even while watching this video. Poor posture can reduce blood flow through your neck, which triggers migraines. Number 7. Hormonal changes. Ladies, you may have noticed that you often get a migraine attack. During periods, some women experience more frequent headaches before and during menopause. This is all because estrogen levels change during this time, which triggers migraines. This is why both Episodic and chronic migraines are usually more common in women than men. Number 8. Sensory stimulation. Many of you like going out to clubs, but is your head throbbing during this time? Loud music and flashing lights are the cause, not to mention all the booze. If someone near you has put on a strong deodorant, it can trigger a migraine or make it worse. Secondhand smoke, room fresheners and the smell of paint thinners also act as triggers for some people. Number 9. The weather. Going out to the park is fun for most of us, but it can bring on headaches for some. People who suffer from migraines are sensitive to bright light. You should also avoid sudden temperature shifts. Humidity and barometric pressure can also affect your migraine. Number 10. Sleep difficulties. If you're not getting the right amount of sleep, you will have a migraine in the morning or later in the day. We all want a little extra sleep on the weekends, right? Sadly, too much sleep can also cause migraines. Routine sleep is the key. Keep your sleep between 7 to 9 hours. Number 11. Medications. You might want to have a look at your meds. Some of them can trigger migraines. For some women, birth control and hormone pills can also develop migraines. Also, if you purchase headache medicine over the counter and consume it for 9 days a month, you might experience rebound headaches. Always talk to your doctor for the right medicine that suits you. People who experience migraines know that it affects various aspects of their life. Focus and concentration decrease. During a migraine attack, the productivity in both your work and personal life will suffer. The best you can do to manage your chronic migraine is to maintain a migraine tracker. Prepare a chart stating the date and time of day you started experiencing the headache, timing of meals and what you ate. You should also write whether or not you were stressed, the number of hours you slept, the current weather, and the meds you're taking. Fill out your migraine tracker religiously and you'll easily find your triggers. You can also seek help from your doctor or change around your lifestyle. Did you chart stating the date and time of day you started experiencing the headache, timing of meals and what you ate? You should also write whether or not you were stressed, the number of hours you slept, the current weather, and the meds you're taking. Fill out your migraine tracker religiously and you'll easily find your triggers. You can also seek help from your doctor or change around your lifestyle. Did you know about these migraine triggers before watching this video? Let us know in the comments below. Thanks for your time, and see you on the next one. Don't forget to subscribe and like the video for more content like this one. Bye for now.